Have you ever wondered why some people, seemingly healthy, eating well, getting regular checkups, still end up being diagnosed with late-stage cancer? It's not because they don't care about their health. It's because some warning signs can't be seen. They can only be smelled. I understand that feeling. When you're over 70, you begin to listen to your body more closely. But what happens when the warning signs don't come from your heartbeat or pain, but from a passing scent? It could be the smell of your breath, your skin, or your sweat, small details that are easy to overlook. Let me tell you the story of Evelyn, 74 years old, living in Wisconsin. She loved nature, often took walks in the woods, ate a vegetarian diet, and meditated daily. One day, her granddaughter mentioned that her breath had a strange, musty odor, like old books in a basement. Evelyn brushed it off with a smile, but a few weeks later, she began experiencing an unexplained sore throat. The diagnosis: early-stage nasopharyngeal cancer. What's alarming is that many people don't realize our bodies, when developing cancer, can emit volatile organic compounds, VOCs, that carry very specific odors. But because our own noses aren't sensitive to our body's smells, we often miss them. The good news is, if detected in time, these scents can help identify cancer early, and that could save your life. Today's video will help you recognize 8 cancer-related odors that many people over 70 tend to ignore. These smells are not frightening, but they are worth paying attention to. If you prioritize your health, please hit like and share this video with your loved ones. Because who knows, today's reminder might be tomorrow's second chance at life. And now, let's begin the journey of uncovering the silent signs that could change your life forever. While we often pay attention to pain or noticeable physical changes, there's one warning sign that's easy to overlook: the smell of your breath. And not a smell caused by food or poor dental hygiene, but a strange, musty odor that lingers quietly. Have you ever noticed that your breath, or the breath of someone close to you, smells like old paper, a damp basement, or unwashed fabric left too long in a closet? And no matter how thoroughly you brush your teeth or rinse your mouth, that smell keeps coming back? Could this be a warning of something more serious? Science is beginning to recognize a connection between body odors and cancer. One of the key findings is that musty-smelling breath may be an early sign of oral or throat cancer. Why? As cancer cells grow, they not only alter tissue structure but also produce volatile organic compounds, VOCs. These compounds are exhaled, and some have mold-like or decaying material characteristics. It's important to note that this musty odor is different from bad breath caused by tooth decay or dry mouth. It carries a damp sensation, similar to the smell of mold in a long-closed wardrobe, and it often doesn't go away with typical cleaning efforts. For older adults, a declining sense of smell makes it harder to detect, while loved ones may hesitate to mention it for fear of causing offense. According to research from the Cleveland Clinic, your breath can reflect the health of your upper digestive tract, throat, and mouth. When cancer cells in these areas break down, they may leave behind bacteria, pus, or dead tissue, elements that produce a distinct musty odor. Notably, early stages of oral or throat cancer are often painless, making breath odor one of the few initial warning signs. The good news is that early detection and treatment are entirely possible if you pay attention to this signal. You don't need to be a medical expert. Just learn to listen to your body and observe small daily changes. If you, or someone close to you, notice a musty breath odor lasting more than 2 weeks without a clear cause, it's wise to consult an ENT specialist or a dentist. Here are a few simple steps to protect your health proactively. Check your breath in the morning before eating or brushing. This is when VOCs are most detectable. Ask a loved one to help notice any strange odors. Others often detect them before we do. Get regular dental checkups every 6 months, especially if you're over 65 or have a history of smoking. Keep a record of persistent odors. If it doesn't go away with good hygiene, note the timing and frequency to share with your doctor. Breath is not just the rhythm of life, it's the silent voice of your body. When we learn to listen to it, we open the door to healthier, more proactive, and more peaceful living each day. Don't dismiss the small signs, because it's often the quietest signals that mark the biggest turning points in your health after 70. And now, let's move on to another scent. Easily detectable, often misunderstood, the smell of rotting stool, which could be a desperate cry from a digestive system under cancer attack. Some odors make you turn your head away instantly, and the smell of rotting stool is definitely one of them. But if that odor becomes unusually strong and persistent, even when your diet hasn't changed, it may no longer be just a digestive issue. Excessively foul-smelling stool could be an early warning sign of one of the most dangerous cancers, colorectal cancer. Have you ever walked into the bathroom and wondered, why does it smell so awful? I didn't even eat anything strange. Or noticed that your stool has a strong, putrid, metallic smell that lingers for days. Don't be too quick to blame the food. Your body may be sounding an alarm in a very unpleasant way. Our digestive system is a sophisticated machine. When a tumor begins forming in the colon or rectum, it can disrupt how food is broken down, alter the gut microbiome, and cause abnormal fermentation. This leads to a buildup of toxic gases like methane, hydrogen sulfide, and amines, substances responsible for that unusually foul, rotting odor. Moreover, colorectal cancer can cause inflammation and ulcers inside the large intestine. This may result in stool mixed with blood, mucus, and dead cells, producing a heavy stench reminiscent of decay. These signs are often mistaken for colitis, digestive issues, or just poor eating habits. But if the odor persists, recurs often, and is accompanied by symptoms like bloating, irregular bowel movements, or pencil-thin stool, it's time to take it seriously and get checked. The good news is that colorectal cancer is highly treatable if caught early. Recognizing changes in the smell of your stool, though unpleasant, is a life-saving awareness skill after age 70. You don't need to be a doctor to stay alert to your body's signals. All it takes is paying attention to what used to be normal and noticing when it changes. Here are a few steps to help you monitor and prevent effectively. Observe the color, smell, and shape of your stool at least 2 to 3 times a week. Take notes if the odor becomes intensely foul, metallic, or lasts more than 3 days despite a normal diet. Get screened for colorectal cancer every 5 years after age 50, or as advised by your doctor. Increase fiber and green vegetables in your diet, while reducing red meat and processed foods. This significantly lowers your cancer risk. Remember, your body never lies. When your digestive system starts sending signals, whether through dull pain or unbearable odor, it's time to stop and listen. A simple checkup today could mean many more healthy years ahead. And if you're ready, let's move on to the next sign. Strange, but not to be underestimated, a sweet, unpleasant smell from the skin that could be the silent signal of developing breast cancer. We often associate sweet smells with something pleasant, like baked goods, fruit, or a light perfume. But if your skin, or that of a loved one, starts emitting a sweet yet pungent and unpleasant odor, it's not something to ignore. Especially for women over 60, this could be an early warning sign of breast cancer, one of the most common, yet frequently overlooked cancers due to its subtle onset. Have you ever noticed a patch of skin that smells sweet, almost like spoiled honey, fermented syrup, or old sugary liquid? It's not from sweat or perfume. It's as if the skin itself is releasing this scent, even right after bathing. This isn't just a personal impression. It's a medically documented phenomenon. As breast cancer begins to develop, particularly in cases involving inflammation or ulceration of the skin, the area around the tumor can become inflamed, infected, or begin to ooze. These secretions, when broken down by the skin's natural bacteria, produce a heavy, sickly sweet smell that others often notice before the person affected does. This is why many women receive a late diagnosis, not because they felt no symptoms, but because someone else smelled something off. It's crucial not to confuse a sweet smell with a pleasant one. The odor associated with cancer often carries an underlying sense of discomfort, a slightly metallic or rotten sweetness that lingers despite changing clothes or washing. It usually doesn't come from the underarms, where sweat is most active, but from the chest or under the breasts. In many cases, this is one of the very first signs, appearing even before noticeable lumps or pain. The good news, if you catch this early, breast cancer is highly treatable. When detected in its earliest stages, the 5-year survival rate is as high as 99%. The key is to pay attention to your body, not just with your eyes and hands, but with your nose too. Here are a few tips to help you stay proactive. After bathing, check for unusual odors in the chest area. If there's a persistent, sweet, or strong smell, take note of it. If the skin around your breasts feels frequently moist, develops unexplained sores, or shows persistent redness, seek medical attention promptly. Take 3 minutes each month for a self-exam. Look, touch, and feel for changes in skin texture and odor. Don't hesitate to consult a doctor if you or a loved one notice an unusual and lasting body odor. Your body is always trying to communicate, and sometimes it uses very subtle signals like the smell of skin. Trust your senses. A small change today could be the key to preventing a major health issue tomorrow. Now let's move on to a more common but frequently misjudged sign. Breath that smells like rotten eggs, a sulfur-like odor that may be a hidden warning of stomach cancer. Most of us have experienced the unpleasantness of smelling rotten eggs, that sharp, lingering stench that clings to the air. But if that smell is coming from your own breath, day after day, it may be more than just indigestion. It could be one of the earliest signs of stomach cancer, a silent, dangerous disease that is often diagnosed too late. Have you ever woken up in the morning and noticed a strong, foul odor in your breath, like rotten eggs, toxic gas, or something decaying? Even after brushing your teeth and using mouthwash, the smell comes back, especially after meals. If you are over 60, this is not something to dismiss. When the stomach isn't functioning normally, especially when infected by Helicobacter pylori bacteria, or as cancerous cells begin to form, it can produce hydrogen sulfide gas. This gas is what gives off the distinct rotten egg smell and is expelled through the breath. The source isn't your mouth or teeth. It's deep in your digestive system, and ordinary breath fresheners won't mask it. One of the most troubling facts about early-stage stomach cancer is that it often presents no obvious symptoms, no pain, no vomiting, no weight loss. Just a subtle change in breath, a small shift that could be your first and only warning. In many studies, patients with stomach cancer recalled beginning to avoid social situations out of fear others would notice their strange breath odor. Sadly, most didn't seek medical help until severe pain appeared. By then, the tumor had already grown significantly. The hopeful news is that stomach cancer can absolutely be detected early, if you know how to listen and act. This is especially important if you fall into a high-risk group, a history of gastric ulcers, H. pylori infection, smoking, or family history of gastrointestinal cancer. Here are a few steps you can take to protect yourself. Pay attention to the smell of your breath in the morning and after meals. If a rotten egg odor lasts more than a week, get it checked. Combine breath observation with other signs like persistent bloating, acid reflux, or indigestion. Schedule regular endoscopies if you are in a high-risk group, especially after age 60. Limit alcohol, spicy foods, and processed products. These can increase the risk of stomach lining damage. Your breath is a mirror of your internal health, and in this case, it may reflect the condition of your stomach. A foul, sulfur-like odor may seem like a minor embarrassment, but it could be a major internal warning. Don't hesitate to investigate, because one simple action today may prevent tomorrow's regret. Up next, let's explore one of the most noticeable yet misunderstood signs: skin that smells like rotting meat, a hallmark of advanced stage skin cancer. We often focus on unusual moles, slow-healing sores, or changes in skin color, but few people realize that body odor can also signal skin cancer. In particular, when an area of skin begins to emit a foul, decaying smell, like rotting meat or decomposing flesh, it's a serious warning that a skin lesion may have progressed into an advanced or necrotic stage. Have you ever noticed a patch of skin, even after being cleaned, still carries a persistent, deeply unpleasant odor, like spoiled raw meat? If this smell accompanies a sore, discoloration, or a wound that won't heal, it's not a minor issue. It may be a sign of skin cancers such as melanoma or squamous cell carcinoma, especially when malignant cells have spread, leading to tissue death or infection. The cause? As skin cancer advances beyond the body's ability to naturally repair itself, affected tissue begins to break down and die. This necrosis results in the decomposition of proteins and fats within the skin cells, releasing sulfur compounds, amines, and other volatile substances, much like the odor of decay. This smell cannot be washed away with soap or masked with perfume, and it often spreads if the underlying condition is left untreated. Skin cancer typically begins with subtle signs: a mole changing color, a cut that won't heal, or an unusual patch of flaky skin. But without attention, the disease can progress silently for months or even years. When the smell of rotting flesh appears, it means the damage has likely reached deeper layers of the skin or underlying tissue, and urgent medical attention is required. The good news is that skin cancer has a very high treatment success rate when detected early. Checking your skin's odor, strange as it may sound, can be a simple yet powerful tool, especially for older adults with thinner, more vulnerable skin. Here's what you can do to protect yourself. Check for unusual smells on your skin, especially on the back, neck, and behind the ears, areas often missed during regular hygiene. If you notice a strong, foul, or decaying odor from any part of your skin, even a small wound, seek medical evaluation immediately. Avoid scratching, covering, or ignoring persistent sores or ulcers with unknown causes. Visit a dermatologist once or twice a year, especially if you've had frequent sun exposure or past severe sunburns. Your skin is more than just your body's outer shield. It's a map that reveals your internal health. And sometimes that map sends signals through scent. Don't ignore a fleeting sense of discomfort. It may be the most important warning your body can give you. Next, we'll explore a very distinct and easily recognizable sign: urine with a strong ammonia smell, a possible silent warning of kidney cancer, one of the most dangerous yet quietest diseases. We often think of urine as just waste the body needs to eliminate, but in reality, it carries a wealth of information about your internal health, especially your kidneys. If one day you notice that your urine has a strong ammonia-like odor, resembling bleach or cat urine, it might not just be about diet or dehydration. It could be an early warning sign of kidney cancer, a disease with few symptoms but serious consequences if detected late. Have you ever used the bathroom and noticed your urine smells unusually strong? Not just after eating asparagus or forgetting to drink water, but a sharp, pungent chemical smell, like something stale or industrial. If this odor lingers for days, even after staying well hydrated, your body may be trying to alert you to something more serious. The kidneys are responsible for filtering blood, removing toxins, and regulating electrolytes. When a tumor begins to form in the kidneys, it can disrupt this filtration process, allowing more waste, especially urea and nitrogenous compounds, to concentrate in the urine, producing that signature ammonia odor. This smell is often most noticeable in the morning or during your first bathroom trip of the day, and it may also be accompanied by symptoms like blood in the urine, pain on one side of the lower back, or persistent fatigue with no clear cause. Unlike urinary tract infections, which can cause foul-smelling urine but usually involve burning or frequent urination, kidney cancer tends to develop silently. Many cases are discovered incidentally during abdominal exams or imaging for unrelated issues. However, subtle changes in urine odor could be the silent clue your body is trying to send you. The good news is that early detection and treatment of kidney cancer are highly achievable today, especially with modern imaging and biopsy techniques. The key is to take action at the first sign of something unusual, even if it's just a strange smell in your urine. Here are a few simple steps you can take. Pay attention to your urine's odor each morning. If a strong ammonia smell lasts more than 3 days, write it down and consult a doctor. Make sure you're drinking enough water to rule out dehydration, but if the smell remains after proper hydration, take it seriously. Watch for related symptoms: one-sided lower back pain, blood in the urine, or unexplained weight loss. Get regular kidney ultrasounds if you have a history of high blood pressure, long-term smoking, or exposure to industrial chemicals. The kidneys are organs that rarely complain until the damage is severe. But sometimes, the smell of your urine is their first cry for help. And you, if you're observant and proactive, could be the first to notice and act in time. Next, let's explore a rarer but highly specific signal: breath or sweat with a metallic scent, a potential hidden indicator of blood cancers, including leukemia and lymphoma. The smell of metal, you may have experienced it after biting your tongue or taking iron supplements, is a distinct, blood-like odor, reminiscent of coins or dried blood. But if you or a loved one starts noticing a persistent metallic scent in the breath or sweat, this may be more than just a matter of taste or mineral deficiency. It could be an early sign of a blood cancer, including acute leukemia or lymphoma. Have you ever noticed a fishy, bloody odor in your sweat, even without much physical activity? Or perhaps someone winced during a conversation, detecting a rusty, iron-like smell in your breath. If this persists and doesn't go away after thorough oral hygiene or bathing, your body may be revealing a deeper disorder within the bloodstream. In blood cancers, the production and breakdown of white blood cells becomes chaotic, disrupting the body's balance of iron, copper, and other minerals. These compounds, when they accumulate in the blood and skin, can produce a distinctly metallic odor. Furthermore, people with leukemia often experience bleeding under the skin, gum inflammation, or mild necrosis in the mouth, all of which contribute to the foul, metallic breath. Unlike common body odors, the metallic scent is often described as cold, sharp, slightly acrid, and unusually persistent. Some say it smells like blood, pennies, or even faintly like burned wires, qualities that help distinguish it from odors caused by digestion or skin issues. What makes blood cancer especially frightening is that it doesn't form palpable tumors and causes little to no pain in its early stages. Instead, the signs are vague: chronic fatigue, easy bruising, or surprisingly, a strange metallic scent you'd never think twice about. Yet being alert to such subtle changes could be the key to saving a life. The good news is that many forms of blood cancer are highly treatable when caught early, especially before spreading to the bone marrow or lymphatic system. Identifying unusual body odors, particularly after age 60, when the immune system and bone marrow naturally weaken, is a valuable skill in staying ahead of the disease. Here are some things to watch for. Pay attention if your sweat smells strange, especially after rest or sleep, not just after exertion. Check your breath by cupping your hand over your mouth. If it smells like blood, metal, or chemicals, consult a doctor. Monitor accompanying symptoms: persistent fatigue, dizziness, bleeding gums, or unexplained fevers. Get regular hematology screenings if you have a history of immune disorders, Epstein-Barr virus, or prior chemotherapy, just radiation exposure. Blood is the essence of life, and when its composition changes, your body will find a way to signal, even in the subtlest ways. A metallic odor may seem harmless, but it could be one of the first warnings not to overlook. And now, let's explore our final sign: unexpected, yet increasingly recognized. Fruity, sweet breath, seemingly harmless, but potentially a silent alarm from the lungs, an early signal of lung cancer. The scent of ripe fruit, like apples, pears, or sweet bananas, often brings to mind something pleasant and refreshing. But if that smell begins to come from your own breath, persistently, without a clear cause, and unrelated to anything you've eaten or rinsed with, it's time to be cautious. This could be one of the quiet, early warning signs of lung cancer, one of the deadliest cancers, yet one of the hardest to detect in its early stages. Have you ever noticed your breath carrying an oddly sweet, fruity aroma? Not foul, not musty, but subtly syrupy, with an underlying sense of unease. You might initially dismiss it as food-related or even your imagination, but when this scent shows up repeatedly, especially in the morning, after lying down, or even while fasting, it could be your lungs sending a silent alarm. Tumors in the lungs, particularly in early stages, can emit volatile organic compounds, VOCs, including aldehydes, acetone, and isoprene. These compounds exit the body through the breath, creating a light, fruity odor. Interestingly, the person affected often doesn't detect it themselves, but others around them may notice it distinctly. This phenomenon has been documented in multiple studies across the US, including ones where trained detection dogs successfully identified early-stage lung cancer in patients, based solely on breath samples, thanks to these unique VOC markers. The danger lies in how quietly lung cancer can begin. There's often no pain in the early stages, no cough, no tightness, no obvious shortness of breath. Just breathe. That smells sweeter than usual. And because the scent is not offensive, many people ignore it. By the time symptoms like coughing up blood, rapid weight loss, or bone pain appear, the cancer may have already advanced. But the good news is, you don't have to wait for severe symptoms to take action. Monitoring your breath's odor daily is a simple yet powerful self-screening tool for detecting lung cancer early, especially if you're over 60 or have a history of smoking or working in toxic environments. Here are some steps you can take. Check your breath in the morning before eating or drinking. If there's an unusual fruity sweetness, keep track of it. Pay attention to other subtle symptoms like a lingering mild cough, hoarseness, or unexplained fatigue. If you've smoked or lived in a polluted area, consider getting a chest CT scan every 1 to 2 years. Don't ignore it if a loved one comments that your breath smells strange. They may detect what you can't. Your breath is the wind from within, and in many cases, it carries the body's most valuable warnings. A seemingly harmless sweet scent may actually be the first sign that could save you from a danger silently growing in your lungs. Finally, thank you for staying with me until the very end of this journey. It's never easy to reflect on something as serious as cancer, especially when it's about your own body, and especially when the warning signs come in the form of scent. Something so subtle, so invisible, that most people never pay attention to it. But the fact that you're still here means one thing. You truly care about your health, about the health of those you love. Together, we've explored 8 often overlooked warning signs, from musty breath to a sweet, fruity scent. Each of these odors tells a story. Each one carries a quiet but urgent message from within the body. And sometimes, just by noticing at the right moment, you could save yourself, or someone close to you, from irreversible loss. So what did you take away from this journey? If you found this content helpful, please hit like and share it with those over 60. Your parents, aunts and uncles, neighbors. With just one click, you might help protect someone else. I hope this won't be our last connection. Follow this channel for more videos, where I'll continue to share early signs, healthy habits, and empowering knowledge designed especially for older adults. Together, we can build a community that chooses to live well, live strong, and live intentionally, no matter the age. It's never too late to start listening to your body. And sometimes, a life can be saved by something as simple as a scent.